In the previous video, we discussed mental health and the impact of the Therapeutic Alliance from the patient's perspective. But what about the practitioners who treat these patients? Mental health issues among clinicians is an area of growing concern. Let me explain. Imagine you, as a current or emerging health professional, are this glass. We as clinicians work in highly stressful working environments. And as rewarding as our jobs may be, they can be equally as taxing. We help people gain back pieces of themselves, but that also can lead us to being exposed to some really difficult situations, with limited time to process what we are seeing. Day after day, session after session, we welcome new people into our therapy rooms, fostering a smile on our faces. And sooner or later, this can add up, and we find ourselves exhausted, on autopilot, and burnt out. Clinician burnout syndrome is an issue globally, and in South Africa, clinician burnout is largely attributed to high caseloads, limited resources, and too few health professionals to meet the needs of the population. The latter is particularly true in speech therapy and audiology in South Africa, and results in more pressure being placed on these clinicians, meaning that burnout is a very real issue. Burnout not only results in mental strain on the clinician, but also impacts their ability to forge relationships with their patients, which impacts these patients' health outcomes. Apathy is also a consequence of burnout and negatively impacts the Therapeutic Alliance. However, we do know that a good therapeutic alliance can act as a protective factor against clinician burnout. Therefore, building meaningful relationships can positively impact the mental health and well-being of clinicians. To quote Scott, a family medicine practitioner, "I realized that the relationships I create with my patients were as important as the pills I dispensed, and these relationships with my patients helped sustain me through some of the frustrating and difficult tasks of practicing family medicine." Research on this area is limited. However, there is some evidence to suggest that the depth of the relationship between the client and clinician can positively impact clinician mental health and serve as a protective factor against burnout syndrome. I hope through this video you have learned that the Therapeutic Alliance is a valuable tool in protecting your mental health as a clinician. In the next video, we will be delving into the first step of how to construct a positive therapeutic alliance. Hopefully, we'll see you there. Bye!